Dear participants, thank you for joining. My name is Luisa and I will be the remote participation moderator for the event. Before starting the meeting, I would like to give some instruction on the Zoom platform and the meeting. Interpretation service is provided for the meeting. Please remember that your remote intervention could be interpreted into the following languages: English, Spanish, and Portuguese. It is important to keep in mind that although the audio quality that you hear might be satisfactory to you, it might still be insufficient for interpretation purposes. As a remote participation, you may occasionally be asked to repeat your intervention in those circumstances. For the sake of interpretation, please speak slowly and clearly. Another point of the meeting is that you can listen to the available interpretation channels by clicking on Interpretation in the bottom bar of the Zoom interface, then selecting the language that you would like to hear. If you want to hear the original audio or intervene, please select Off Interpretation menu. In fact, Off means simply floor. Participants in a language channel will hear the translated audio and also the original audio at a lower volume. To hear only the interpreted language, click Mute Original Audio. And the last point is, if you would like to intervene, you will need to set your audio channel to the correct language. You will either need to select Off in order to speak on the main channel, the floor, or you may choose the language channel that corresponds to your spoken language. Every effort is being made to facilitate the smooth flow of this meeting. This meeting will now start. I remain available in the chat if you need any assistance. Thank you very much and have a pleasant event.
Before we start, a big thanks to our technical moderators who've taken care of ensuring that the event proceeds smoothly. So before we begin, good morning, good afternoon, good evening, everyone. Hello and welcome to episode 10, the role of digital technologies on aging and health. This webinar forms an integral part of the ongoing Digital Transformation for Cities and Communities webinar series. I'm Mythili Menon from the ITU, the International Telecommunication Union, welcoming you today. The webinar is being jointly organized by the ITU and the Pan-American Health Organization, or PAHO. The program for today's webinar will be linked by my colleagues in the chat. This webinar will explore the opportunities and challenges related to the use of digital technologies within the healthcare domain. Without further ado, to commence today's webinar, I would like to call upon Mr. Nasser Al-Marzuki to deliver the opening remarks. Over to you.
Thank you very much, Mythili, and thank you also to Luisa for helping us and for all the technical support provided by ITU technical team. Okay, so good day, ladies and gentlemen. It's my pleasure to welcome you to episode 10 of the ITU webinar series on digital transformation for cities and communities. Today's webinar is dedicated to the theme, the role of digital technologies on aging and health. Episode 10 is jointly organized by ITU and Pan-American Health Organization. A recent United Nations report stated that there were 737 million people, approximately 9.3% of the world population, aged 65 or over in 2020. The proportion is expected to increase to around 16% in 2050. With the impacts of COVID-19 still looming, healthcare systems needs to continue to evolve in order to meet the healthcare needs of an aging population and more. In response, digital technologies are augmenting healthcare systems with emerging capabilities to help improving health monitoring services, boosting older adults' health literacy, and providing better overall care to all. For years, ITU, through its development and standardization sectors, has played a significant role in supporting the widespread deployment of digital health and e-health applications in cities and communities. For instance, ITUT Study Group 20 is the lead study group on IoT and smart cities and communities. The group, which I have the pleasure to chair, has developed technical standards that provide technical guidance for defining the requirements and capability framework of e-health monitoring services. ITU standards have also described the IoT requirements for wearable device related services, including smartwatches and VR headsets that are used for elderly care. I'm very excited that today we will be joined by experts from around the world who will be sharing more information on IoT standards and how on ITU standards and how ITU activities are providing new opportunity for cities and communities to adopt digital health applications and systems. Once again, I would like to thank everyone for joining us here today. At ITU, we believe that facilitate global learning is an important step to shed lights on key topics such as digital health. So with that, I wish you all a productive and informative webinar. I thank you. Back to you, Michael. Thank you very much.
Thank you, Nasser, for the very enlightening remarks, which really set the stage for what is up ahead today. We have an excellent lineup of speakers, and we're of course counting on you, all the participants, to help generate an engaging discussion for today. So before we move on, I would like to highlight some of the housekeeping rules. So the event will be held in English, Spanish, and Portuguese. You can select your preferred interpretation icon at the bottom of your screen. All questions will be taken from the audience during the Q&A section, which is after all the presentations have been delivered. Participants are invited to use the Q&A icon that you see at the bottom of your screens to type in any and all questions that you have. When you're typing your question, please mention the name of the panelist that you would like to address the question to. And we will, of course, post a recording of the workshop after it is over. And all presentation material will also be available on the webpage for the event. So thank you all once again for joining us. We shall now start the sessions for today's webinar with session 1 on connecting digital transformation with aging and health. So without further ado, I will give the floor to Ms. Cristina Bueti, who's a counselor for the ITUT Study Group 20 on IoT, smart cities, and communities. Over to you, Cristina.
Thank you, Michael. And good morning, good afternoon, and good evening to all. I'll be speaking in English, and then maybe during the session I can switch also in Spanish. So my name is Cristina Bueti, and I'm the ITU focal point of Smart Sustainable Cities. And really, it's a great pleasure for me to be your moderator for this session. As we all know, aging population is greatly impacting the public health sectors of cities and communities, and this inevitable demographic shift calls for a new approach to healthcare and highlights the need really to make cities more age-friendly and inclusive. Digital transformation is helping cities and communities to adapt to this new reality. And in this session, we will be looking at some examples of how digital innovation are improving healthcare services for the elderly. If we have sufficient time, we will also have a question and answer section towards the end. Now, as we have several speakers, we have lots of information to cover today. Without any further delay, I would like to welcome our first speaker, Patricia, and allow me in particular to thank Patricia and the entire PAHO team for the excellent collaboration that we had in organizing this webinar jointly. It has been really a great pleasure to work with you, Patricia, and the entire PAHO team. So Patricia has been working on health aging projects from the Department of Family, Health Promotion and Life Course at PAHO, headquarters in Washington, D.C. and that is the regional office, WHO office for the Americas. So Patricia, the floor is yours.
Hello, everyone. Thank you so much, Christina, for the introductions. And thank you so much for the opportunity to collaborate and jointly work on this webinar. We are very happy, and we are hoping that this is just the first one that we can work during this decade of healthy aging that I'm going to present right now a little bit about. So I'm going to share my screen. Can you see my presentation? Okay. So again, thank you very much. Thank you very much for ITU and all the team for the opportunity to be here this morning to talk a little bit about the role of digital technologies on aging and health, especially in the context right now of the decade of healthy aging. So PAHO in 2017 stated that aging is one of the main drivers for public health, along with the burden of communicable diseases, climate change, migration, and inequities. And in the region of the Americas, the aging of populations occur faster than in comparing to other regions of the world, especially Latin America and the Caribbean. So by 2030, the Americas will have more older adults over 60 than children under 15. And this transition we will occur 15 years before than compared to the whole world. But in the region, healthy life expectancy is lower than overall life expectancy. It means that people are living longer, but they also are living longer with more chronic conditions and disability. So the gap right now in between healthy life expectancy and life expectancy in the region of the Americas is approximately 10 years, and of course, being different in different countries. So with the idea of improving the life of older people, the Decade of Healthy Aging was approved at the 73rd World Health Assembly on August 3rd last year. And in December last year, it was proclaimed a United Nations movement by the General Assembly. So the Decade of Healthy Aging is a framework to transform the current scenario into a more positive one, fostering a more inclusive, equitable, and age-friendly society based on human rights. The Decade of Healthy Aging is aligned with the 2030 Agenda for Sustainable Development of leaving no one behind. And to achieve the sustainable development and the goals, societies must take into account the aging of population and also take into consideration the present needs, but the future needs of older populations, and taking and considering a life course approach that people, the things that people do in their lives will affect the way that they are going to age. So the Decade of Healthy Aging proposal highlights all the aspects that we should be working on each of the goals, considering older population specifically to help to achieve the goals. And I want to highlight the goal for this webinar, the goal number 9, and which is about industry, innovation, and infrastructure. And how on the Decade proposal, it's highlighted that it's crucial to have age-inclusive, affordable access to internet, new technologies, and to enable healthy aging. So what does it mean, healthy aging? Since the launch of the 2015 Global Report on Aging and Health from WHO, healthy aging definition is far away from having or not having chronic conditions. In fact, healthy aging is the process of maintaining and developing functional ability that enables well-being in older age. And functional ability comprises all the health-related attributes that allow people to be and to do what is important for them. So functional ability is the ability people have to meet their basic needs, learn, grow, and make decisions, have mobility, establish and maintain relationships, and contribute to society. So to achieve this functional ability, or the functional ability is determined by the intrinsic capacity, which is all the mental and physical capacities a person has available, and the environment and the interactions between them. So the environments are all the context which people live and develop, and they can determine what other people can do with the other people with a determined level of functional ability, of intrinsic capacity, and what they can do. So the environment, in fact, they don't include only the physical and built environment, but also the community and the society in general, and as well as products, equipments, technologies that facilitates and enable older people to do and be what they want to be and do the things they value. So the decade of healthy aging will focus on 4 action areas. Change how we think, feel, and act towards age and aging. Ensure that communities foster the capacities of older people. Offer integrated and person-centered care and services that respond to older adults' needs. And provide access to long-term care for older adults who need this type of care. And the decades plan emphasize the importance of improving technological, scientific, medical, assistive technologies, and digital innovations to foster healthy aging. On my presentation, I'm going to focus on the 2 main areas, the 2 first areas of actions, because my colleague Yuka will be talking a little bit more about integrated care and services, health services for older people in her presentation later. So about ageism and this area of action of changing how we think, feel, and act towards age and aging, WHO has launched the global campaign to combat ageism, and as part of it is the global report on ageism. So data from the report shows that there is a digital divide between older and younger generations, and I think this is even more evident during the pandemic. Also, the report shows that older individuals who internalize the stereotype that older people cannot master technology, they may not even try to adopt and use those. And when it comes to developing new technologies, usually older adults are less included in focus groups to assess and evaluate this design of new technology. Concerning the second area of action about the environment, I want to talk a little bit about the use of technology to improve the environment. So the Decade of Healthy Aging Baseline Report, which was published by the end of last year, shows the example of Chicago, which is one of the world's most geotagged cities. And geotagged through geocoded maps, using Google Maps, for example, can bring data and information to access information about how people have access to cities and specific services. So it helps to understand and to make policies to make the city more accessible and more age-friendly. So Chicago is part of the WHO Age-Friendly Cities and Communities since 2012. So they have a lot of, since then, they have been developing different strategies, including those using technology to be more age-friendly. And there is a lot of different examples available on how they are doing that on this report. So one example, just to mention, is that they have a Chicago Health Atlas. It's a website that has interactive maps of health-related data over time and across communities. And they also have locations of various health resources and how accessible they are. Also, Chicago was the first city to launch the Array of Things, and this is a network of interactive sensor boxes around the city that collect real-time granular data on the city's environment, so they can help to target specific responses to improve the environment for the residents. Another example comes from Chile, that is also one of the countries that is growing the most on the WHO Age-Friendly Cities and Communities Network. And with support from local universities and strong collaboration of older adults, they have been developing 2 apps. One specifically to address the built environment, so older adults can, through the app, talk to the local government and make sure what's not working well, what are their difficulties, and what are the suggestions to improve the environment. And the other one is an app to try to bring closer older, vulnerable older populations, especially those dependent or living in remote areas that have difficulties in accessing services and in being in contact with the health providers and the community. So on this, during the pandemic, we conducted a survey with age-friendly cities and communities from the Americas, trying to understand the role of being part of the network and how it helped to help older adults during the pandemic. And the cities that participated on the survey, they mentioned that it was one of the key messages that access to technology, it was key to be able to connect with older populations. But at the same time, they highlighted that a significant challenge was the lack of access from technology. So they could access easily and make connections with those that had technology, but a lot of other people that they needed to connect to didn't have access to technology. So that's one example of why and justify this year's theme of the United Nations International Day of Older People, which was digital equity for all ages. Also, to highlight the importance of this topic, this report from the Economic Commission for Latin America and the Caribbean, the ECLAC, shows the disparity among internet use in the region of the Americas, comparing younger and older generations. And although technology has a great potential to reduce barriers and improve healthy aging, there is a need to policies and practices to make it more available to older populations. And although the levels of internet use among older adults are still quite low in some countries, it is increasing in the region of the Americas. So this is important to point out. And the decade of healthy aging will be, or the work on the action areas will be, the foundation will be these 4 enablers of the decade of healthy aging. So it's crucial to be working with them to be able to achieve the strategies on each area of action. And the first one is listening and making older adults participate in everything. We have to understand their needs to be able to have adequate policies, nurturing leadership and capacity builder, connecting different stakeholders, and of course, data research and innovation. And to work on these enablers, the main strategies is through technology. So there was this platform that was developed, and it's available in English, Spanish, and French right now. And this is the main area or strategy to make these connections to live, to share knowledge, to have the voices of older people shared. So I invite you, everybody who's interested, to join the movement, be part of the Decade of Healthy Aging, and share your innovation projects, your ideas, your knowledge on the Decade of Healthy Aging platform. This is the link. And for who is interested in more information on healthy aging and the work we do in PAHO and in the Americas, this is our website. And thank you very much for the opportunity. And I'll be open for questions later.
Thank you so much, Patricia, and please join the movement. They're doing really fantastic work in this area, so I really encourage you as well. I would like now to call on stage my colleague, Roxana. Well, Roxana is the expert in the ITU, so allow me to say that she is really our, I can say, ambassador in this case on this topic. So who better than her that can tell you about all the wonderful activities that are being carried out especially in the development sector of the ITU on this topic. So she has over 20 years of experience. She is really dedicated and passionate, I can tell you by experience. So without any further ado, I would like now to ask Roxana to deliver a presentation.
Thank you very, very much, Christina. So, well, to set the scene on the role of ICT on aging and health in the context of our digital world, I would like to present you a very short video that will also highlight some of the work that ITU is doing in the development sector to support ITU members, but also the countries and all the stakeholders involved in this challenge to overcome the two global mega trends, which is aging population and technology race. And of course, all this to support the healthy aging of present and future older person. So colleagues, could you please run the video?
The world is digital and its population is aging. For the first time in human evolution, people aged over 60 have outnumbered children under 5 years old and are predicted to reach 2 billion by 2050. Older persons have always been an asset to their families, communities and societies. Nevertheless, they're being perceived as a vulnerable group, dependent on younger generations. The digital world can, no doubt, enable older persons to participate and contribute to society, turning this misconception of vulnerable into valuable. In an interconnected world, information and communication technologies, or ICTs, can empower and contribute to healthy, independent and fulfilled lives of present and future older adults. ICTs, if provided in accessible and user-friendly formats and platforms, can be valuable enablers for older adults, helping them to overcome more easily age-related limitations, including hearing, dexterity, and visual impairment. For example, accessible smart televisions, allowing users with hearing aids to enjoy all types of entertainment content with their families. Use of virtual assistant technology to obtain all types of information and access online services. Use of zooming features to increase the font size to facilitate reading. The digital context reduces distances and avoids isolation and loneliness. It also facilitates active participation in all aspects of today's society. Therefore, by building accessible and inclusive digital environments, all users can adapt technology to their specific abilities and needs. For instance, they can buy products more easily, using the e-commerce process, manage their finances and payments through e-banking, continue lifelong learning thanks to opportunities offered by e-learning platforms, contribute to society, including sharing their experiences and enhancing constructive dialogue between generations. Moreover, in 2020, the Global Coalition on Aging estimated the global market value of older adults, the so-called silver economy, at $17 trillion and growing. There is a huge business opportunity for this untapped market. To help member states create accessible and age-friendly ICT environments, the International Telecommunication Union, ITU, has developed the report, Aging in a Digital World, From Vulnerable to Valuable. The report not only raises awareness of the trends and good practices, but also provides concrete guidelines to ensure healthy, happy, and valuable aging, and empower older persons as active participants in their digital communities and societies. For more information on ITU's work and resources on digital inclusion, please visit www.itu.int.
Thank you, colleagues. So we saw that we are facing the megatrend of aging, long lives to 100 as a matter of course, and more old than young in all societies. as they modernize is one of the powerful global trends jointly with, of course, technology race of our 21st century. So as of today, 1 billion older adults over 60 will double to 2 billion in the next 3 decades. It becomes evident so that aging in the digital world can turn the paradigm of vulnerable into valuable, as we actually name our report. I will tell you about a little bit later. So it's obvious that technology will play an important role on this context. So COVID pandemic clearly emphasized the difference between those who have access and knowledge to use ICTs and those who haven't. So in this context, during 2021, the UN proclaimed the 2021 to 2030, as the colleagues mentioned before, the decade of healthy aging, which represents for ITU a unique opportunity to bring together all stakeholders to work together and improve the lives of today and tomorrow older adults. Next slide, please. So another trend is the global urbanization. So we see that its effect in the next 3 decades, almost 17% of the global population is projected to be urban. So governments are also challenged to mediate all these trends of urbanization, increasing population, most aging, increasing technology, and how to best ensure the provision of services to all citizens in an equal and equitable manner. So collective efforts from all stakeholders will be required to ensure that everyone, including older person, are part of this equation. So means to consider their needs and requirements and to ensure that all these are taken into account. So moreover, from our own research, the intergenerational role to overcome this gap, it's also part of the solution. Next slide, please. Yeah, I think, okay. So we talk about, let's say, smart environments, digital environments, smart cities. So from our side, I think, at least here with this audience, we're quite familiar about the digital and smart environments. And what is very nice is that ITU also defined the smart sustainable cities as innovative cities that use ICTs and other means to improve quality of life, efficiency of urban operation and services, and competitiveness, while ensuring that they meet the needs of present and future generation with respect to economic, social, environmental, as well as cultural aspects. So we do have here the definition, which is what the smart sustainable cities are, but how to build them. This is another story. And here came the accessible ICT and the whole ICT accessibility requirements and standards, which are essential elements to satisfy these needs of present and future generation without any, let's say, discrimination of gender, age, or ability. So from our perspective in the development sector, we believe that incorporating digital accessibilities in the design stage of smart cities, communities, and environments, this is the secret actually to ensure that no one is left behind and the smart cities can be actually an environment for all type of citizen, regardless of their age, gender, or ability. And this could be our Smart for All. Next slide, please. To achieve this, what we are doing is, of course, raising awareness. Actually, the work of the development sector in this topic begin with the call on decade of healthy aging. So all the work that I will present you today is the work that we achieve since this year, of course, based on, as my colleague Christina just mentioned, actually about 20 years of experience in digital inclusion in general. But so we raise awareness about all this, but we also try to provide policy and strategy recommendation. And to do so, we identify best practices and solutions, and of course, try to develop concrete tools. The concrete tools are the reports, like the one was already mentioned, and I will tell you immediately a little bit more, but also to try to develop trainings for not only for policy and decision makers, but for everyone. And I will explain you why it's so important that every stakeholder be prepared for this, let's say, for the future of aging. Next slide, please. So we mentioned a little bit about this report. Indeed, the report Aging in the Digital World from Vulnerable to Valuable, it's available in all 6 languages in digital accessible format. That means can be also consulted by person with hearing and visual disabilities. And the report actually raises awareness on the need to incorporate accessibility since the design stage of the digital solution that are provided to everyone. And it also present the fundamentals and the steps required to achieve inclusive and digitally accessible communities and environments. Finally, we also share some guidelines and practices. And what I want to highlight here is that this report is based on concrete facts. And we were very pleased to see that some countries have already some advances on this. And some members are already preparing the future of their old generation. So I invite you all to take a look on this report. We also, next slide, please. We also had the pleasure to launch on the 1st of October, which was the International Day of Older Person. First ITU online self-paced training course is ICT for Better Aging and Livelihood in the Digital Landscape. And again, we actually complement all the information that the report has with some more concrete activities and concrete knowledge on the fundamentals about digital accessibility, but also about the key elements of the digital inclusion in general. So how to approach the knowledge, and not only the digital knowledge, I would say the appropriation of ICTs by older person. I think we all have a mother, and we know how challenging it is when she changed the mobile because she wants the same mobile that she had before, and this model is not anymore available. And the difference between using the mobile just because is a need, or just using for facilities to make a payment, to order something, or just to ask Siri about the weather. So it's yet a way to go from digital skills to appropriation. And we try to share all this in this training. And more than this, in this training, we also try to highlight a little bit let's say for the private sector, the potential of the silver economy now at 17 trillion, which actually trigger towards substantial transformation of the existing businesses models, and as a consequence will also strongly influence the whole global social economic ecosystem. And so we present all this. I also invite you, it's also available in 3 languages, English, French, and Spanish, also in accessible digital format. And we'll also have a new training to be launched next year, but I just want to give you a flavor on it. It's about beyond smart cities to satisfy the needs of everyone. So to build this inclusive and age-friendly environments. Next slide, please. So looking ahead, which will be the steps to be taken by all parties in the context of these 2 global mega trends plus the urbanization? I put here a little bit what each of us can do. Of course, government should implement and consider already address some policies and strategies to take advantage of these digital opportunities. But also to prepare in general. This goes, we can speak a whole day about this because this also will impact academia, the future of work, of young generation, and so on. Private sector, of course, private sector should definitely take into account this silver economy and also adapt the products and services to ensure that this responds to a larger end user. I cannot highlight enough to say that everything we do, we definitely should consider and take on board the representative of the end users, because only by working together we can ensure that whatever we are doing respond to the needs of the specific end users. So of course, I put here a small incentive to say that the digital inclusion of older adults is a win-win for all parties involved, which I think it's really a truth. And all of us have a role to play in building inclusive, accessible, and age-friendly environments and societies, and so enable a better aging in the digital world for all. And talking about aging of the digital world, I will present you my last slide, in which I will invite you all to very quickly take a look of your country, identify where is your country, and take a look how will be from the perspective of aging from now in the next 30 to 40 years. And you will see that most of us, well, we live in a very old environment. And if this could be quite scaring, I think ICT is part of the solution. So this can make a fundamental difference in our future life. And from my perspective, ladies and gentlemen, aging is a privilege, and aging in the digital world, it's an opportunity. So let's join our efforts and work together to build a digital inclusive and age-friendly world with suitable condition for healthy living for the older adults of today, but also for tomorrow. Thank you for your attention.
Thank you, Roxana. thank you for your presentation, and thank you for sharing with us all these interesting activities. I think that I saw a comment just in the Q&A chat that sometimes there is too much information and can be overwhelming. I agree. How to solve this, I don't know. IT is doing many things, but also, you know, other partners are doing fantastic activities. I can share with you that in terms of smart sustainable cities, we are working on a toolkit for digital transformation for people-oriented cities. And it will also include a module specifically on this issue. So, you know, probably that toolkit will aim at least to help to, in a way, provide a sort of one-stop information where you can find at least the relevant info in one place. And then, of course, when you want to go in depth, you'll have to consult the different resources. I hope that that responds at least to the question raised by Gloria, and thank you also for asking this question. So now we will continue actually with the program. So we are gonna now welcome a colleague from UNIC. So Vitalia, that heads, she leads actually the population unit of the UNEC and is responsible also for UNEC work on population aging and international relations. She coordinates the activities of the UNEC Standing Working Group on Aging, and she's also the coordinator of the Generations and Gender program. So I'm very pleased actually to welcome Vitalia with us, and thank you also for, you know, accepting to speak at this event. So the floor is yours.
Thank you very much, and thank you for inviting. I'm pleased to present something from our region, from the UNEC. Let me share my presentation. Bear with me. And let me go to the beginning. Up. I hope you see it well now. So actually, we hear already from the speakers and from the opening as well that the digitalization holds important promises for aging populations. And the aging population is one of the mega trends that really define our 21st century very strongly. So those promises relate to innovations, to efficiency gains, to cost reductions, including in the health and the social care sectors, as well to the labor market adjustments and lifelong learning, social participation, just to name a few. We also, when we think about all the population, these promises are very strong regarding the assistance and gains in autonomy and independence for all the persons whose physical and cognitive abilities may be impaired. So these are important promises. However, can these promises be fulfilled in the near future? Because now they're not yet fully fulfilled. So this is also a question for what the government, what the other stakeholders, the producers and innovators of these digital technologies, but also civil society can do, what kind of policies and solutions they can look forward to. The COVID-19 pandemic really has highlighted this unequal access to the digital technologies across and within the populations. Not only access, but also affordability, but ability to use all elements of this broad access, as I think Roxana mentioned before. And these inequalities might be exacerbated, but they might be also gradually narrowed. And sometimes I say this can be seen as a glass half full or glass half empty, depends in which group you are of optimists and pessimists. And are you a proponent of the digitalization or you are more scared about it? We see this across the population, different views. So in my presentation, I briefly will say a few facts about digital gaps in the UNIC region and talk about the barriers to digital inclusion and some suggested policy actions and good practices in the region that appear. I think you heard already quite a lot about how this population aging is a trend, a mega trend and effect, but actually this region, which is the northern hemisphere of our Earth, of our world, is already quite aged. If we account for less than 17% of total world's population, today our population 65 and older is already more than 30% of all world's population. And those that are 80 and plus, they are close to 40% of our population. So we are already accumulating this experience in our region, and we have countries that are very ahead with the digital technologies, with digital services. You probably heard Estonia, you probably heard Denmark, where e-government is practically 100% implemented, and some other countries that are lagging behind in it. We have now 1 in 6 persons who are 65 years and older in the region, and in 2050 it will be 1 in 4. But we have very diverse region that is Western Europe and the oldest countries like Italy with a median age 47 by now and a bit, and the very young countries like Tajikistan or Kyrgyzstan where you have median age below 30. So this is not uneven, but the digitalization is going across all the regions. And the access to it, and as I said, ability to use it is not equal. And often it's called as digital divide, intergenerational digital divide. It has a sense. If you look at this data, you can see that share of individuals who have basic or above basic digital skills in our region, this is half of our region, EU 27 in 2019, is a very different picture when you look at the younger generation and when you look at the older generation. And 65 to 74, it's only 1 in 4 who have these basic skills. And if you look even older population, it's of course even less. But that's actually a normal sense of the historical development. This younger generation was born already in the period of the access to digital devices from cradle, let's say, but while the older generation had to learn about it. And this is not only generational divide or age group divide, it is also the main factor, it is these cumulative disadvantages that people in the old age groups already acquired that came with it, with a lower education, lower experience, or lower access to the lifelong learning, etc. So you have a different also pattern. One has to think about when one thinks about solutions, how differently approach to it. I will show you a few other charts just to give some data input for that. But first of the glass half full, I want to say it's really fast developing and improvements are coming quite quickly. When you look at the 10 years of the last development from 2011 to 2020, you see that in 2011, we had countries where more than 90% of persons 65 to 74 were not using internet at all, never used. By now, you wouldn't find its majority of countries, more than 50% already are active on internet, more or less, more frequently or less frequently, but really that. And in the Nordic countries, practically every older person already has an access to the internet and uses the internet from time to time or more frequently. As I said, the differences are in the how you use and what you use, what kind of skills you have for that use. So this is, we have some data that shows the gender difference. But gender difference in our region is, again, is not very prominent. In some other regions of the world are much more prominent, women lagging behind in the digitalization. While in our region is not as big difference, but there are some patterns that you can see what female and what male users of the digital technologies on ICT are involved into. And let's say e-banking or the working with the e-government, accessing the information more in the public spaces, for the public services like paying taxes, etc. It's more males oriented, but many others, even accessing health information, is more female oriented. But as I said, the main difference relies in the socioeconomic background and also in the educational background. And these are also accumulated over the years because those who have high education, the tertiary education, usually they also are involved over the years in the long life learning, in the activities and the training. Most of their professional life require this updating the skills. While those who are in the low education and who are involved in the manual jobs may not have been exposed at all to this work, to the learning and to the using digital technologies. And for them, it's a huge leap. So when one thinks about solutions and support, one has to think about these different groups. And we have these very different groups across this older age group, as we say, from 55 to 100 or older. It's a huge group, and it's very diverse with all these different abilities that came throughout the years. So what are the barriers as we see, as we look into it through, they were mentioned already by some speakers before, but when you take the environment across the cultural, social, economic, psychological, health and disability status, these elements are working together. They are intertwined, and they may become a barrier or maybe also an enhancer in certain parts. So lacking digital skills, I already mentioned, and I mentioned the main things behind, like socioeconomic or educational background. Ageism, we heard already from the previous speaker, is an important element actually, especially when you have this confidence, loss of self-confidence, which is exacerbated by the media often, by the different projection of the older people, but also sometimes in there is actual discrimination and prejudices. And when the goods, digital services are designed, they may not take into account this group of users. So design and target products are very important elements. But not only the design that is accessible, that is universal, it can sometimes has to be targeted. But another thing, what sometimes puts older people off from using digital devices, assistive devices, etc., because they are developed without their involvement, without interest in how they will use, and they are just tried at the very end of the process. And sometimes it is really not taken by the user, but also often, and actually the title of this event is more on the health, and often that the most of the digital technology devices and apps, etc., for the older people are oriented for the health sector. And sometimes it can also be off-putting because people also want to have leisure, want to have some hobbies, and it's where they can use the digital devices. And starting from this part can help them to take also interest in other elements. Of course, physical and cognitive impairments might be another barrier, a strong barrier, which might be with a disengagement without being no interest in participating. But here also we have quite a good practices and examples from the special trainings for the people with dementia in the Netherlands or in Canada, and there is a possibility also with these impairments to involve people. Accessibility, as Roxana was mentioning about the possible accessibility, there are also tools on the in that video, that for the people with the, let's say, Parkinson, with the hearing aids, it's an important element that helps to overcome. But these barriers exist and we have to take care of. So what kind of solutions or suggestions we come up? My presentation is actually based more on the policy brief that we issued this year in July on aging in the digital era. And we just had in November a policy seminar with the countries and the civil society and other stakeholders presenting what kind of solutions they come up with, the suggestions. And there we looked at the ensuring equal access to goods and services, enhancing digital literacy, but important element was also leveraging the potential of digital technologies for active and healthy aging, and certainly protecting human rights of all the persons in the digital era. So if we look at the access of goods and services, not to take too much time, I would figure out where we kind of go into the support for use of digital services, which is a very important element. You need to have tailored support. And that tailored support sometimes can be also promoted by the government measures through the government, or insisting that this is included in the, let's say, consumer rights, that the certain services that move to the electronic services, to the digital services, that they provide the tailored support. Also, guidance to the service providers, important to make these online services accessible, and ensuring digital literacy and providing coaching. This is extremely important. One element that still stays, and actually many countries ask to include it as the offline access to goods and services. Not everyone can, but also not everyone is ready to move on to the digital platforms all the time. So the access to information is a human right. So they have to have this access, and one has to think how to provide it, not discriminating all the people in that respect. Because we know that many services move and then okay, we will provide to you offline access, but you will have to pay additional fee, pay additional that, and it might affect a lot the people in the poor strata of society and the older persons as well. The training, safety and security training is extremely important. And when we come to the leveraging the potential of digital technologies for active and healthy aging, it's reducing the loneliness and enhance connections. That is one of the paths that we focus on, and opportunities for health aging and independent living, where we talk about the e-health services, health management through the use of the services, and facilitating independent living through the use of digital devices. There are several good practice examples. I will not stop now. You can look at our policy brief, but there are several practice examples that are proposed by the communities, by the civil society. Like this example from Ireland is the civil society organization Alone that looked into technology engagement of the older persons and tried to develop their BeConnect process for the older persons, older colleagues, and etc., using this two-way approach. We also have an interesting example from the Czech Republic about the virtual reality. This is when you design it involving participants. Actually, they involve the residential care participants to figure out what makes them, what interests them, where they would like to be in, what they would like to see, and what helps them to work on their memory in the area. So it's forest, it is the little city, the center, the churches. So, and they develop this virtual environment tool to help them to work on it. It's an interesting experiment, and it seems to work quite well. There are other good examples from that point of view. And for the human rights, of course, participation in decision-making and free and informed consent is extremely important in this age group. Because when we talk about people with dementia, when we talk about the people who are not have the access to the whole information, this is really important to assure. So I will finish here. My time is over, and I'm glad to answer any questions if you have. Thank you.
Thank you. Thank you so much for the insightful presentation. And thank you, most importantly, actually, for sharing with us all the activities that are taking place actually with UNEC. Well, ITU and UNEC have a very long-standing collaboration in many areas. So I think that that's another field that undoubtedly we need to explore further. So,
by the way, we developed a policy brief on aging in smart and sustainable cities. We published it last year, working together with that network. So that's part. 75% of our population live in urban areas, so it's an important part.
Exactly. So that's where, you know, indeed we need to really build synergies on that. That's really a common field. So I'd like now to move to our next speaker. Is another colleague from the UN family, Yuka Sumi. She's the acting head of aging and health at WHO. And Yuka has really extensive experience. She also acts as secretariat for WHO's clinical consortium on healthy aging, coordinating the ICOP pilots and implementation and development of intrinsic capacity assessment tool. So without any further ado, I'd like to ask Yuka to join us on stage and deliver a presentation. Thank you.
Yeah, thank you very much, Maria, for a kind introduction, and hello, everyone. So today I'd like to talk about more focusing on the care delivery and how we can use technology to provide care for older people. Let me share the screen now. So I will talk about integrated care for older people, role of technology to provide care for older people. COVID-19 pandemic has highlighted the advantage of telehealth or telemedicine, telerehabilitation to facilitate healthcare delivery to older people and monitor and follow up their health and well-being. Lack of access to the internet and communication technologies prevents older people from seeking health information online and receiving health services remotely, leading to feelings of social exclusion and exacerbating health disparity among older adults. If you look at the figure at the bottom about internet activities seeking health information in 2009 and 2019. In these 10 years, apparently there is a more increased people accessing health information through the internet, but still when you look at the three age group, older people are still behind in terms of the connecting to the internet to get the health information. Since previous presenters touched on this topic, digital skills of older people, so I will not go in details, but the important message here is digital literacy are the precondition for the digital inclusion for the older people. Technology can help to maintain older people's dignity and autonomy, sense of self-worth, and the right to self-determination and contribute to their well-being, including AI-based tools such as physical assistive robots and the socially assistive robots. There is a considerable evidence gap on the effectiveness, acceptance of AI-based technologies, usability for older people, as well as feasibility in low and middle income countries. Every older person deserves an equal opportunity to benefit from digital technology. So what can be done to provide integrated care for older people with the use of technology? Integrated care for older people reflects a continuum of care that will help to reorient health and social services towards a more person-centered and coordinated model of care that supports optimizing intrinsic capacity, that is physical and mental capacity, and the functional ability for older people. When people age, their intrinsic capacity tends to decline. The speed of decline might be different between people, and their health and social care needs become more complex and long and chronic. So we need to understand what is the needs of older people in terms of health and social services and provide a person-centered care based on their needs. Here is the principle of the WHO Icorp person-centered care. The objective is to maximize intrinsic capacity and functional ability and to prevent decline in this intrinsic capacity and functional ability. And we also need to understand the values, goals, preferences for the older people so that assessment should be person-centered. And then based on their preferences and goals, agreed with older people, we can provide a personalized care plans. Interventions can be delivered in a community level at home. It doesn't always require specialist consultation. We need to involve the multidisciplinary or different occupation care teams so that all the needs are addressed. For example, nutritionists, physiotherapists, GPs, nurses, and pharmacists. We also need to support for self-management and self-care. During the COVID pandemic, this importance of the self-management and self-care has been highlighted. When older people have a significant loss of physical and mental capacities and requires assistance from the outside, the caregiver burden would be significant. We also need to support the caregivers by providing training and by providing respite care. Even though Icorp person-centered care can be delivered in the community and home, still we need to link to the referral when needed to the specialist. And we also need to monitor and follow up the care plans. This is not the typical disease diagnosis and treatment, but more to understanding the needs based on the trajectory of the intrinsic capacity and the functional ability. So this is not about one point time fixation, it's more the life course approach. Declines in intrinsic capacity are expressed very frequently by common impairments in older age, such as difficulty with hearing, seeing, remembering, and walking. And these problems are often overlooked by health professionals and interpreted as sign of so-called normal aging. So this is actually ageism attitudes. Early markers of declining intrinsic capacity, such as decreases in gait speed or muscle strength, are often not identified, treated, or monitored. The majority of health professionals also lack guidance or training to recognize and manage impairment in older age. So how this technology, digital technology, can help to support this capacity building? We have identified these 6 domains, including limited mobility, malnutrition, visual impairment, hearing loss, cognitive decline, and depressive symptoms are closely related to the care dependence in older age. There are evidence-based interventions available to prevent these declines in intrinsic capacities. WHO has provided guidelines and guidance to support health and care workers to provide evidence-based interventions, including Icorp guidelines published in 2019, encouraging countries to include these interventions under universal health coverage, We have implementation tools, including Icorp implementation framework that is guidance for system and services targeting policymakers and the service providers. Icorp handbook that is a practical guidance on person-centered assessment and pathways in primary care. We also have an Icorp handbook mobile app of this Icorp handbook. So this Icorp handbook offers a step-by-step approach that guides health and social care workers to detect and manage decline in older people's physical and mental capacities, as well as social care needs. These are available in the Google Play and iOS. This handbook is designed to support community and primary care workers to assess the health and social care needs of older people and design a personalized care plan, starting from the screening to the person-centered assessment in depth of older people's health and social care needs, and then develop the personalized care plans together with the older people as well as caregivers. WHO has a different digital app called Here WHO that is based on the validated digit in noise technology. And currently this Here WHO is connected to the Icorp handbook app in English, Spanish, and Mandarin. From now, I would like to show some examples how Icorp handbook has been used as a training tool. One is in Vietnam. This is a training for trainers in 2020. Despite COVID situation, Vietnam actually prioritized the capacity building for the health and care workers. And you can see that they are using the app to understand step-by-step how to provide the care for older people. Last September in 2021, this year, in Cape Verde, they also provided the Icorp training for the healthcare workers and using Icorp handbook app. So these are the examples. Actually, digital tools can be used as a training tool. And then I also shared some example, the implementation of the Icorp program. This is from the Toulouse in France, Inspire Icorp Care program led by the WHO Collaborating Center. They actually adapted the Icorp handbook app to their system called Icorp Monitor app with the database, with a conversational robot Icorp bot. These two tools can be used by healthcare professionals as well as older people and the caregiver. So they provided two versions so that the utility of the Icorp Monitor app can be enhanced. As of this November, more than 10,000 older people joined this care program, and 50% of screening was done by this Icorp Monitor application. 70% of people are monitors more than 6 months, and 12% are followed for more than one year, utilizing this Icorp monitoring platform. They also checked the acceptability of older people, asking 3,000 older people. 40% responded to the survey, saying that more than 80% were very satisfied with digital tools. Another case study from Kanagawa Prefecture in Japan. Kanagawa Prefecture has 9.2 million people, and more than 28% of the population is aged over 65 years old. This prefecture developed the Mibyo concept that considers people's physical and mental conditions as a dynamic continuum rather than the sharp line between health and sickness, and providing prevention strategy. This app has been downloaded more than 1.2 million people that allows older people to calculate his or her own Mibyo index and monitor their scores through the measurement of physical and mental capacities. And then the app provides advice based on the behavioral index result through in the algorithm aligned with the WHO Icorp approach. So there are many good examples happening using the digital tools. So we have more opportunities throughout the decade of healthy aging. Thank you very much for your attention.
Thank you very much. Thank you, Yuga, for sharing with us actually WHO's very relevant activities. So without, let's say, without any further ado, I would like now to move to our last speaker. Last but not least, and I'm very pleased because I have actually the pleasure to moderate a panel that is with all women. So today it's really a very positive coincidence that there are so many women on a panel, and we're going to conclude at least this this session with Inga. Inga works at CityBits. CityBits recently joined ITU as one of the new members, and she also in this panel represents the private sector. She has over 10 years of a cross-sectoral experience in international business, and also has built strategic relationships with stakeholders across different cultures, languages, and countries. And she is an experienced data-driven business leader. And when you will find out from a presentation what kind of magics they are able to do with data. So Inga, the floor is yours.
Thank you so much for the introduction, Christina. It's an honor to be here. And I'm looking forward to sharing some insights from what we're doing at CityBits. Let me just share my screen. One moment, please. Okay, good afternoon, everybody. My name is Inga Caesar, as introduced by Christina. And I'm looking forward to sharing some insights as per how we are utilizing artificial intelligence to support society on the process of aging and health. To begin with, I would like us to all reflect. How old are your parents, grandparents, or neighbors? The last time that you had to get medical attention, did you consider the role of technology? Did you get the feeling of a general improvement thanks to the technological advances in the healthcare system of your town, city, or country? I know that these might sound like very personal questions, but we are here today to talk about a topic that touches all of us, no matter our gender, nationality, or age. Aging and health are two aspects inherently linked to our human nature. And that is why the digital transformation that we're experiencing is so important now and in the future. So how can we prepare to deal with a society that is progressively getting older? I've noticed we've seen the same chart before, so it's a very relevant picture to look at. From the previous presentations, we learned about some inspiring examples of how digitalization is used today to understand and answer people's healthcare needs. Let me show you now a few examples of how CityBits AI technology helped organizations like the World Health Organization, the International Development Bank, or Fundación Once understand citizens' opinions and to act up on their specific needs. CityBits is a software as a service company with an ethical and social focus. So we are developing AI solutions to detect changes in society earlier than any other survey method or media. So changes can be seen as potential risks, but also as opportunities for governments, authorities, and organizations to act with a positive social impact. As we like to say, to shape a better future, you need to start predicting the present. So let's dive right into it. I would like to provide you a first example. We are facilitating the technology to launch a project with the World Health Organization called EARS. EARS stands for Early AI-Supported Response with Social Listening. EARS aims to better understand how people have been feeling during the pandemic. The platform, where you see a screenshot of the public page, provides insights to understand what are people's concerns and needs, and detects information voids that will help shape public policy to manage the pandemic and fight infodemics at the forefront of this health crisis. We have scaled up to 30 countries and 9 languages and are currently covering 41 topics related to the COVID-19 pandemic. These are topics such as the cause of COVID, industry and economic impact, or variants of the virus, which is currently one of the highly debated topics. Now, leveraging CityBeat's technology, WHO's analysts can flexibly investigate what topics are raising and see how countries are evolving. We really want them to go from the general raw conversation all the way to the most actionable insights. So for this, we developed intent detection. Intent detection allows to differentiate between general opinions, questions, or complaints to really understand the sentiments of the citizens. This has been proven to be very powerful in the context of implementing health policies. So for example, when a country rolls out a vaccination campaign, an increase in questions may suggest that the information provided by the health authorities are not clear enough. Whereas if there's a rise in complaints, this may indicate that something in the rollout strategy itself is not working well. The WHO published this public platform to democratize the insights in real time. So I encourage you to later have a look by clicking on the link in the lower bottom to have a look around and understand the insights that are generated, because it's really fascinating and revealing about what you can learn as per how are people feeling at the moment about the pandemic in different countries. Another example is our cooperation with the International Development Bank. We launched the Civic Lytics platform to facilitate a deep understanding of complex civic issues by listening to the concerns of millions of citizens in Latin America. Our platform was able to inform their 26 country members of social needs 90 days earlier than traditional analysis methods. Among topics analyzed were the general health care and as well the mental health discussions. Some exemplary insights that were detected were, for example, early warnings about the shortage of antidepressant in pharmacies in Chile or COVID vaccines in Haiti. And here we have our last example, which is a project in Spain with Fundación 11, which are an organization that helps with the social inclusion of disabled people. The project we launched with them was about understanding where in the cities were the most problems for people with disabilities. And so it allowed local governments to allocate resources and increase the accessibility. In the graph, you can see the impact of different barriers like infrastructure or transportation for each of the disability types. So like such as cognitive or visual disability. So we're really aiming to give different groups in population a voice to facilitate an improvement facilitated by the authorities. As you can see from the wider use cases, our platform has the capacity to generate granular insights about health topics for any group of the population. So if I'm a decision maker, I'm able to present a query to the platform, such as whether my vaccine program was successful among elderly people in my city. And as you can also see here on your screen on the map, we're able to literally zoom in and see how specific cities and regions feel about each individual topic, providing a very profound and deep analysis into the problem. And for the next slides, I would like to provide you a bit of technical context. So on which kind of data do we rely on to generate such impactful insights? What was really surprising to me is that 90% of the world's online data was only generated in the last 2 years. I assume that also the pandemic and different lockdowns really accelerated that process. So in the year of 2021, people are using digital communication platforms to express their concerns and needs. The problem here is that 80% of the text-based data is unstructured, meaning you cannot easily capture, label, or analyze the data without previous modification. So it's essentially lost. And reacting late to societal concerns due to not analyzing this unstructured data has a significant financial and social cost. With CityBeats, we are able to provide that crucial analysis on social topics ahead of the traditional communication flows. So we want to enable organizations to be able to better orientate themselves towards the actual needs and concerns of the citizens at the moment, instead of lagging behind until after it has already been amplified in the media. So what is our solution to gain insights from unstructured data? It's a relatively simple three-step process. We are able to take the data, and this can be any data from sources such as Twitter, Facebook, Instagram, comments on the news, blogs, etc., in any language from anywhere. We meet this data with algorithms using natural language processing, machine learning to structure it. And then we extract those insights and analytics for organizations to make better decisions in real time. We can also plug in proprietary data. So that means data from the partner itself, like public chatbots, radio transcripts, or surveys, and also additional public data. That way we can connect to over 1 million sources. It is important to note, and a key differentiation point for us, that we are language agnostic. So that means that our technology works in every single language all across the world. And we also reduce bias. So for example, Twitter is a male-dominated domain. I believe 65% of Twitter users are men. So we are able to provide the client with a normalized version of the insight, having it to be fully reflective and inclusive of society, with a 50% men and 50% women output if the client chooses to enable us. In general, we collaborate with important partners to set a standard in terms of ethical and responsible AI, like ATU, Fairlag, UN, and Twitter. In addition to the partnerships displayed on the screen, CityBeats has been recognized internationally with prestigious awards, such as the United Nations World Summit Awards, the COGX for the Best Artificial Intelligence for Public Services, or also the NTT Open Innovation Contest. In just 3 years since founding CityBeats, we have calculated that we are 90 days earlier to provide analysis for organizations than traditional analysis methods. We have represented 70 million voices in over 55 countries and positively impacted over 1 billion in budgets. And we are also tackling the UN's SDGs through the various use cases and projects that we have, really aiming to have that positive impact on society. And yes, to end this round of speakers, I would love us to end the session with a quote by Nelson Mandela, for us to reflect how a responsible and inclusive society should behave. Progress is looking forward towards a future of digital innovation and sustainable development, but it is also looking at the present and value the lessons of the past. So thank you so much for listening, and I look forward to your questions.
Thank you so much, Inga, for this inspiring presentation, and also finishing with this beautiful quote from Nelson Mandela that remind us actually on even our duties. So we have a bit of time for question and answers. So before we move really to the final closing remarks, can I ask all participants, do you have any questions? Do you have any questions, any comments, anything that you would like to share with us today? We have responded to a few questions in the Q&A chat, but this is really an opportunity in case you have any questions. So, well, I really would like actually to ask one question, if I may, to Patricia. So what's in your view the role of communication and technology on social protection and access of older persons to services?
Thank you, Christina. I think this question there was a lot of insights on that during the presentations. But I think it's very important to point out that technology can improve connectivity and reach to older people, their friends, family members, healthcare providers. because we've been seeing during the pandemic a lot of strategies on healthcare, on the approximation and the delivery of telework, but there is also this huge use of technology to protect older adults from loneliness and to increasing the contact and the participation. Actually, also talking about the silver economy and their participation on life learning activities, this all communication can play a huge role. I would also like to mention something about the importance of technology on this new family structures, or the way we live our lives right now, that everybody is so connected. We have opportunities to be working worldwide in different countries. I talk this from myself specifically, so it's very important to have these opportunities to connect, and because families are living far away from each other. And so being able to connect with your parents, grandparents, and so they are more easily connected to different people. It can be just their family members, the ones that they care for, but also with their healthcare providers, and also with social services that can help to provide support needed when they need, especially for those that have some specific care needs too. So yeah, I think it's very important, and we have to move forward with policies to increase the availability and digital literacy and access, so they can, older adults and everybody can have this great use of technology.
Thank you so much, Patricia. And following a bit, along these lines, I'd like actually to call Roxana and ask, in your presentation, at some point you mentioned we need to change from, from vulnerable to valuable. So which are the main pillars to build a digitally inclusive world for all people, regardless of age, gender, or ability, in your opinion?
Yes, sure. So sorry, I was losing you a little bit. So it's about the digital inclusion. Can you just, I was switching from a device to the other exactly in the moment you.
I was asking, in your presentation, you emphasize the importance of really considering, not vulnerable people, but valuable people. So I was asking really, which are the main pillars, according to you, to build a digitally inclusive world for all people, regardless of age and gender or ability?
Sure. So I believe the short answer, it will be the 6 A's. So to be very straightforward for us, of course, the most important is access and broadband. So without ensuring that access is in place, we cannot build on achieving this digital inclusion. And then affordability. Affordability is a very strong barrier that from time to time we mix it between accessibility and affordability, and these are two different things. So affordability, in particular, when we think an older person, I think it's very important to be considered and to be addressed either by governments, either by private sector, to ensure that these people can also have the financial means to not only pay for the access and connectivity, but also for the device to be used. And then the accessibility. And the accessibility, of course, has another 3 A's, which is adoption of policies and strategies by countries. Accessibility of ICTs, mean the ICTs like the smart technology who have embedded the accessibility features. So all these features that we saw in the video, that can be used text to speech, the speech to text, increase fonts, and also that can be used by older person, by person with disability, by migrants, and by everybody in a specific circumstance. And then the digital skills and the adoption, as already mentioned, I think it's very important to look exactly at the end user. Even when we build a curriculum, when we build whatever program to to be addressed to the older person and digital alphabetization or the digital skills, we have to take into account their specificities. And then once this is done, the adoption is also very important, because as I saw, the fact that we learn a little bit how to do it doesn't mean that we adopt it. So I think if we manage to have all these A's in place, I definitely think we can be sure that we build a digitally inclusive world for all.
Thank you so much, Roxana. And I really would like also to share a comment made by Carlos that says, to really obtain results, especially in our development countries, I think an initiative promoted by UN people, many of us can really do something about this very important and difficult topic. We all are going to follow that way, and there are so many elders all alone because their sons are living out of country, and that is really so true. So we must do really something. That's maybe a call to action, at least to those of us that we are in this webinar. So I'd like also to ask Vitalia, what are really, in your opinion, some of the key barriers for all the people to use digital technology? We have, I think Roxana highlighted some of them, but do you have any thoughts? Anything that you would like to share with us?
Roxana mentioned all these 6 A's, and these are the core, actually. In the last year's Commission for Social Development at the UN, there was a call from civil society to make internet a public good, not to have to pay the fees for the access to internet to all the service providers that sometimes can be exhaustive. So these 6 A's are important. But as I said, there are also, I mentioned the all intersectional part of these barriers. And one of these barriers is this usability and also involvement of the older persons in their design of the digital devices, of the digital technologies, not only at the end of process, but from the beginning of the process. And this is one part that is still often omitted by the producers of the digital technologies, even in e-health and in other elements. Let's say from my practice and from recent work we've done on the rapid assessment of COVID impact on long-term care services. We also looked at in Kazakhstan into cities, and there was no information, collected information on the users of the care services, because it was by application only, but not by the servicing the communities who needs it. And when the COVID hit, it was really very difficult to find the people who need it. Not only, it's if you have for the access, it's a barrier that if you don't have information which is accessible and which is collected in the centralized hub of the city. In the city, it's important part. So having the information, using this information to devise the services, it's also the bar. If you don't have, it's a barrier. So for me, it is an important element. And it's not only in Kazakhstan or somewhere. You know that in the UK, when the COVID hit, it came out that in the institutions, in many of the care homes, there was no internet access for their patients, for their residents. And it's not only UK, but in many cases, it was not.
I can confirm that the same happened in Italy. So, I'm Italian, so regretfully, I must say that, we suffered so much, and,
No, but that is where these 6 A's, but also very down to earth elements and the design of the digital devices. It's very important.
Thank you so much. Thank you so much, Vitalia. Maybe if I may ask Yuka, any last thoughts that you would like to share with us?
Yeah, thank you very much. I talk about more the healthcare provision, long-term care provision. We can use the digital technology. And then when the COVID really hits, I actually asked the low and middle income countries' healthcare givers. And then, even though they collect the information through their phone, but when they contact their patient or older people, actually they use a landline, like really phone, just having a voice. Because there is still the gap in terms of accessibility, affordability, internet use. So still a lot of work to be done, but the health and social care workers are more keen to use the digital technology to provide better care for older people. And one of the challenge always I was told is just sharing the information and sharing the data. Because digital technology enable us to collect the data, but at the same time, there are bit of hesitancy how to share the data, how much data we can share with different stakeholders, which is still a bit of a challenge to provide a one-person-centered care plan. Because when you develop the goal of the care, develop the care plan, all the information needs to be gathered to understand what the priorities for the older person. So many challenges still happening, but they are really keen to change, support their change. Thank you very much.
Thank you so much, Yuka. And then I have actually, there's a question for Inga. Ophir is asking, can they know who are the voices of older adults among all other voices out there? Inga, question for you.
Yes, thank you. We are currently working on developing that feature. It's what we refer to as age segmentation. So from the social media that we are processing with our machine learning tools, we can label specific segments of the population. So I mentioned, for example, that we are currently already detecting the gender of a comment or the origin, which country it belongs to. So what this question refers to is if we are able to put a label on the post, if it's an adult or a child. And this is technology that's very advanced and we're working on it. So we are planning to launch that to be possible in 2022. So as per mid-2022, we should be able to share more insights about that. And it's definitely one of our main focuses, because in the digital world, more and more young voices are being represented, and the needs of young people and adults can be very different. And it's very valuable to understand what are young people themselves talking about and what are adults talking about young people, and how do those two streams of communication align. So the answer in a nutshell is, at the moment, we don't have it yet, but we're working on that as a high priority for the year to come.
Thank you so much, Inga. And I see that Ophir, is thanking you also in the chat. So with that, I'd like to conclude this session. It has been a great pleasure and honor for me to moderate this session. I'm particularly delighted that we were able also to finish on time our session. So I'll now conclude at least my part. I'd like to thank once again, Patricia and the entire PAHO team for, really the excellent collaboration. And then, as Patricia said, this is really the first of many other activities that certainly we will carry out together in 2022. So stay tuned. And then Maitli, back to you. Thank you.
Thank you, Christina. Thank you, Christina, for guiding the discussions. As you mentioned, we're perfectly on time as well. So we will now move on to the closing session of today's webinar, for which I would like to give the floor to Ms. Tanya Marcos, who is the Vice Chairman of ITUT Study Group 20 on IoT, Smart Cities and Communities. Over to you.
Thank you very much, Ms. Hill. Thank you. Well, thank you all for the excellent moderation, Christina. And also a big thank you to all our speakers for joining us. Today, we have had an excellent discussion on the remarkable potential of digital technologies to support healthy aging and independent living, and to enhance the quality of healthcare for older adults. We learned about the activities carried out in ITU, the United Nations Economic Commission for Europe, UNECE, the World Health Organization, and the Pan American Health Organization, and the MIT and CityBits As Vice Chairman of ITUT Study Group 20 on Internet of Things and Smart Cities and Communities, I feel obliged to emphasize once again the importance of international standards and remind everyone that Study Group 20 has already developed technical standards for accessible IoT applications and services, and standards that help to implement e-health monitoring system services. Looking forward, the group is also working on developing new standards that will ensure semantic interoperability between e-health services and other IoT platforms. These standards will enable the integration of data across verticals and sectors, greatly improving the physical and syntactic levels of healthcare services and services within the cities. You can find more information on the Smart City standards we are working on in the work program of ST20, which is available in our website. I also encourage you to join us in the rest of ITU webinar series on digital transformation for cities and communities, and learn more about our other Smart City standards. If you have any questions or feedback regarding the webinar or the work of ITU on e-health or smart sustainable cities, please feel free to reach out to us. We would love to hear from you. Please also be informed that the highlights of this webinar, including key recommendations along with all presentations delivered, will be made available on the ITU website, where you can also find our contact information. I wish you a wonderful rest of your day. Enjoy the privilege of growing up one day older. Thank you very much. Goodbye.
Thank you, Tanya.
Thank you. Thank you, everyone.
Thank you.
Bye.
Have a nice day. Bye. Bye-bye.
Thank you. Bye-bye.
Bye.